Actually, we have many works in this field. Since 2018, we have more than 25 peer-reviewed articles on the relationship between nutrition, diet, and different type of headaches, especially migraine headache. And as you know, environmental and lifestyle factors can be involved in the pathophysiology of migraine headache, though previous evidences are mainly focused on trigger foods and those activities in our lifestyle and in our nutritional habits that can trigger migraine headache, not those that can act as prophylaxis. And still, we have lack of evidence to cover all the issues in this regards, but we tried to address some of the main approaches in this field. If I want to categorize our works and categorize the evidence that is now available in this field, we can say the first one is about weight management and obesity. Second one is about dietary patterns. The third one is about trigger foods and what to avoid and what to enhance in diet. And the third one goes to different type of supplements from nutraceuticals, vitamins, minerals, and so on. So about the first one, which is weight, the relationship between weight and migraine headache has been studied in pediatric migraineurs and also in adults with different level of overweight and obesity. And we know that the odds of migraine can be affected by weight. Those who are overweight can have about 35% higher odds for migraine. I mean, body mass index of 20 to 25. And those with morbid obesity means BMI of more than 40 or more than 35 with one comorbidities can have even 80% increase in odds of migraine headache. Among our studies, we have a cross-sectional study about the BMI levels and migraine, and the more interesting ones is about bariatric surgery in morbid obese individuals. Those who underwent bariatric surgery, those morbid obese individuals who underwent bariatric surgery, after 10% of weight loss, experiencing 68% of those individuals who have 10% weight loss become free of headache. And it's very interesting. Also, there are other studies in this field in pediatric migraineurs and adolescents with migraine headache that they revealed too that weight reduction with behavioral therapies, having good diet and having good exercise can affect very positively on the prevalence of migraine headaches. Then it comes to dietary patterns. Having a healthy diet can have a very good effect on migraine prophylaxis. By having a healthy diet in young individuals, in adolescents, and in pediatric migraineurs, we checked the food items, different food items that count as healthy diet and the effect of them on pediatric migraines. And we found out that having enough consumption of dairy products, by having enough consumption, I mean about 1.5 cup of low-fat dairy products, and I want to insist on this low-fat because we didn't find out the same relationship between high-fat dairy products, can decrease the odds of migraine in a very good level. And also having enough fiber intake, I mean vegetables and fruit intakes in adolescents and in pediatrics can also have a prophylactic effect on control of their migraine headaches. And then it comes to adults, following a Mediterranean style diet, which is now very popular in Western Europe, fortunately, and goes from those Mediterranean countries like Turkey and Greek, and it's spread out through the Western European countries. And we found out good results of following Mediterranean diets by having enough fruits and vegetables, olive oil, and nuts in a daily enough amount can have prophylactic effects on migraine headaches. And also other criteria of a healthy diet are all effective. Then it comes to supplementation, first of all, we checked the gut-brain axis, which is today is of great interest. And now we know that our gut microbiome has a profound effect on our health, and between them is central nervous system health and headache. So we first check this line by checking the prevalence of gastrointestinal disorders in migraine patients, and we found out that they suffer from more prevalent type of these gastrointestinal problems. Then we supplemented them with probiotic. In chronic and episodic migraine, we found good results about the effect of supplementing with probiotic on the severity and also the frequency of their migraine headaches. And then we have a good review article on it with European Headache Federation about gut-brain axis in headache prophylaxis. And then we designed some studies on B vitamins and D vitamin and their effects on migraine prophylaxis, which I prefer to go back to Professor Togha for this part.
Thank you, Dr. Razeghi, for your good presentation. We had different studies on vitamin B group and also vitamin D3. At first, we studied the level of serum level of vitamin B12 in migraineurs in comparison to healthy subjects. And interestingly, we found that the level of B12 is lower in migraineurs and the level of methylmalonic acid is higher in migraineurs. It was so interesting for us because before the study, we didn't expect such a great idea that there is difference between two groups. After this result, we prefer to start supplementation with different type of vitamin Bs. We know that vitamin Bs are working with some different type of efficacy. Most of them is about energy supplementation of cells and also mitochondrial function and ATP production. That we think that in migraine there is some deficiencies in energies and also dysfunction in mitochondria and decrease ATP. That some studies showed these changes that I told you. And the effect of vitamin B mostly are due to the effect of on energy and metabolism and ATP. We start to the first study of us was about vitamin B supplementation in permenstrual migraines, or the better word is menstrual related migraine. As you know, most of the migraine patients suffer from more severe and more prolonged attacks during before menstruation, during menstruation, or after menstruation, with the changes in hormones, especially estrogen level. For our first study, we prescribed an injection with 100 milligram vitamin B plus 100 milligram of vitamin B6 and 100 B1, 100 B6, and 1,000 microgram B12, 1 week before start of menstruation. And interestingly, we found that it's very effective, significantly effective for decreasing severity and duration of menstrual-related migraine. Then we encouraged to do more studies on different type of vitamin Bs. In comparison of different type of vitamin Bs, vitamin B1, vitamin B6, vitamin B9, vitamin B12, and in comparison to vitamin B complex, and in the other arm with placebo, 6 group, we try to find differences in the effect of different vitamin B groups for decreasing migraine attacks, regarding severity, duration, and also abortive drug usage during the attacks. And interestingly, we found that each of these vitamins, also vitamin B complex, has nearly similar effects. You know that there are many studies of vitamin B2 for migraine, and the work on the other vitamin Bs are scarce. But in our study, in comparison to different type of vitamin Bs, we found that there are most of them work. And there are no so high differences between them. Vitamin B9 was a bit more effective, but was not significantly different with the other type of vitamins. Also, we have a review of vitamin B supplementation, and we could show that vitamin B supplementation could affect in decrease in severity, frequency, duration of migraine, and also abortive drug usage, and also in we showed that there is effect on inflammatory cytokines, decreasing inflammatory cytokines and decreasing pro-inflammatory factors. And maybe apart from the effect of energy, mitochondria, and ATP, vitamin Bs could affect on inflammatory markers and factors. That we know that these inflammatory factors are involved in migraine attacks. Then we moved to another vitamins, vitamin D3. And in the first study, we decided to find if there is any differences in migraineurs and the control healthy groups in the level of serum vitamin D3, and we found there is a difference. And migraineurs migraineurs have a lower level of vitamin D3, even if there is not insufficient or deficient, but the level is lower than the healthy subjects that don't have migraine. And also, deficiency of migraine D3 led to higher odds of having migraine. After this study, we did different type of studies of migraine, of vitamin D3 on migraine, regarding the effect on CGRP, also interleukin 6 and interleukin 17, and the other pro-inflammatory factors and cytokines, and showed that there is effect from vitamin D3 on these factors. And by decreasing inflammatory status in migraine, vitamin D3 could work. After that, after several studies on vitamin D3, we decided to do a review on vitamin D3. And in the review, we showed that regarding the studies by different authors all over part of the world, the supplementation with 1,000 to 4,000 international units of vitamin D3 per day could help in improvement of migraine headache, in frequency, severity, and also duration of migraine, and decrease the usage of abortive drugs. And because of that, after these works, we decided to study on different type of migraine, also in different ages, if the vitamin D is so important that we hope to publish these articles in near future.
To add just 2 sentences, the first one is about vitamin D. Even if the migraineurs have the sufficient or have the normal level of serum vitamin D, they will benefit from vitamin D supplementation. And the other thing is that many of these nutritional interventions work through controlling neuroinflammation, also have some effect on CGRP level that if anyone is interested in, they can find the results of inflammatory of these interventions on inflammatory markers and CGRP level in our articles. Thank you.
And also one sentence about our group. I want to introduce our group. Dr. Razeghi, could you help me in introducing our group in nutrition? The head of nutrition group is Dr. Razeghi. Because of that, she could better introduce her colleagues and my colleagues also.
Thank you. I think we gather a very good group of interested researchers in this field, and we are among the unique groups on studying nutrition and headache. So we have different members in our group from different fields, biotechnology, nutrition, pharmacology, and medicine. And also we have shared works with other countries like Germany and United States. Even our probiotic research resulted in a product line in UK and US with a specific probiotic supplementation for migraineurs.
And about the name of our teams, please.
Yeah, in many of our articles, we have Dr. Qorbani, Zainab Qorbani, Fahime Marshami, Shadi Aryanfar, which I think, and Morwarid Nur Mohammadi, which I think are the core.
Shiva Nemat Gorgani. Because they work a lot. And they are very bright young colleagues of us, and we think our work continue. We hope our work continue and could help migraineurs in different parts of the world by the result of our studies.